action. So we're going to be doing the abdomen and hips for my client Grace here. And the abdomen is so important because it is the front of your back. And the way that this works, the myofascial release, is holding for an extended period of time to let the fascia release. And so engaging softly, so no force, soft, and there is a barrier that then starts to release, and that is when the fascia can start to unwind. So I'll be holding this for up to 3 minutes, and I'll also show you about like the abdomen. So right here is the psoas muscle. So here in the hip, we got the iliacus, the iliopsoas. And so releasing this is going to release those lower back muscles. It's also going to be releasing the hip. So if you're having hip pain, obviously going to the hip. And then also everything's interconnected. So we got the hip that's connected. Oftentimes, like, people will start to feel like releases in their neck when I'm releasing their hips, and then also anything that's lower back. If you have like a sacrum issue and that hurts like on both sides or right in the middle, instead of going with someone face down, which is what people think of with massage a lot, myofascial release comes at it at a different angle a lot of times, which is coming in slowly. And the whole thing is like presence and softening into the motion. So I'll be coming in like this into the psoas, and then all the abdominal muscles, and over a period of like, I could be holding it for minutes, honestly. So that's what this work is, very slow.
Question.
Mm-hmm.
How do you know that it is unwound?
I start to feel the fascia like moving underneath my hand. And then also restrictions. If there is something that is, a tight muscle, I could even start to feel that unwind and like soften. I can also come at it like kind of like on a direct angle. So I'll feel right where the restriction starts and slowly dip in. And once it starts to release, it will soften, and then I can just go slowly in a little bit more. So we're not forcing anything, but letting the body speak. And as the body's speaking, emotions can get released, stuck trauma from holding patterns, bracing patterns. So, and what we're introducing is living water into the cells of the body. And a lot of times the fascia, if it's restricted, the water in the blood is not able to move well through the cells, and that's where the restriction's happening. A lot of times, like the pins and needles or the numbness that goes down to your arms or your legs, it's due to the fascia being restricted, and the blood and oxygen, the living water, isn't able to flow smoothly. So a lot of times nerves get activated and then muscles start to fire after this work is done. And then, so what happens is that the fascia is released, and therefore it's bound around the muscles, and then the muscles release on a deep and lasting level. So